Hey, DNA. Kate Wilson here with another episode of All Access DNA. Today we are talking to Dr. Matt Goldstein, CEO of the nonprofit JScreen. He tells us about his daughter Javi and losing her to Tay-Sachs disease, a neurodegenerative disorder. We talk about grief, disease prevention, and the mission of JScreen to make genetic testing accessible. Let's get started. Thank you so much, Matt, for being on the show today.
Thank you. It's great to be here.
I'm glad we get to talk. I got to chat with you a little bit at the Love Danielle film event that happened here in Atlanta because we had talked to Devin and Amy a couple months ago about the film and making it and bringing awareness to BRCA. So it's nice to kind of have this extension of a conversation that I had with you at the film premiere.
Yeah, absolutely. That was such an incredible event, and I'm such a huge fan of the two of them and what they put out into the world.
Yes, and I'll put in a plug as well that they did get on streaming, so I'll include some notes about that. But I wanted to shift gears some and talk not just about the work that you and your organization JScreen do in terms of BRCA, but I also wanted to talk about other conditions and other types of screening that JScreen also provides, as well as get to know you and your personal story and kind of your passion, your motivation, why you do what you do.
Great,
And
great.
yeah. And so I think where we probably makes the most sense to start is to talk about your daughter Javi. So I was wondering if you could tell us a bit about her.
Yeah, of course. My daughter Javi was born on our wedding anniversary in 2018. 2 years to the day, actually. And she was beautiful and strong and developed normally for about a year until her 1 year appointment when the physician noticed that she was missing a few developmental milestones and gave us a diagnosis of developmental delay. That sent us down a diagnostic odyssey trying to understand what was going on. And over the next 3 months, we saw a number of different physicians. We had Hav in occupational therapy, physical therapy, early intervention. And December 17th of 2019, she was about 15 months. We got the devastating diagnosis that she had Tay-Sachs disease. It was particularly shocking to us because both my wife and I had had preconception carrier screening here in Boston, and my wife was reported as a carrier. I was not. And Tay-Sachs is an autosomal recessive disease, meaning that both parents have to carry a copy of the abnormal gene, of the mutated gene, in order to pass it along to their kids. So our history didn't make any sense with Hobbs' diagnosis.
Mm-hmm.
That diagnosis, as many of the listeners may know, is terminal. Infantile Tay-Sachs has no cure. Kids live for usually 2 to 4 years after their diagnosis. And it is a devastating neurodegenerative disease. We had Hav for another 13 months after that diagnosis. She died January 20th of 2021. And in trying to understand what happened and how that carrier screening result was reported
Mm-hmm.
incorrectly, we learned that the physician who had ordered my test ordered the wrong test and misreported my carrier status, which is just inconceivable.
Yeah.
And that has led me to the work that I'm doing today. I think Hav is such an inspiration for what I do. And this work is a way of bringing her with me to the office every day. It's a way of keeping her present and keeping her in my life, and a way of me being able to be her dad,
Mm-hmm.
which is obviously not anywhere close to how I would like it to be, but it's what I have, and I'm grateful for it.
Well, and I appreciate you sharing that and talking about her because I think, like you said, you know, just because somebody is no longer here anymore doesn't change the fact that you're her dad, that you're her parents, right? And that will always continue. And so, you were a physician scientist. You studied at Stanford, Harvard, before getting married, having children. Was this an area you had planned to work on even before having this personal connection, or how did that change kind of what you had envisioned for yourself in your career?
I studied cancer immunotherapy for my graduate work, and was really focused on the ability to use cancer genetics to devise novel, powerful therapies for treating cancer. And
Mhm.
after I finished residency at Brigham and Women's Hospital in Boston at Harvard, I moved into biotech to try and develop medicines for cancer. I spent time at two companies, was involved in building and founding two companies, both of which were working really at the cutting edge of the cancer genomics space.
Mhm.
And when Javi was diagnosed and our world was turned upside down, and I found myself digging into the whole field of preventive genetics and genomics and trying to understand how we could transform the way those tools are used, I really found myself at an opportunity and a moment where my personal life and my professional life kind of collided into this
Mhm.
space. I'm not a geneticist by training, but I was keenly aware of the power of genetics in medicine. For me, for a while, it was in thinking about how we could come up with new therapeutics. But as I learned from my explorations after Javi's death into the preventive genetics space, where
Mhm.
screening becomes a very powerful tool to identify individuals who are at risk and to ultimately change or potentially, in some cases, eliminate the possibility of disease in their life, I really felt like this was what, in some ways, I was put here to do.
And you mentioned the prevention, almost a way to be proactive, knowing some of these genetic results, genetic information. Tell us a little bit more about the preconception carrier screening. So, carrier screening typically is done on parents, so mother or father, to see if one of them carries a genetic predisposition to a certain condition. Can you tell us a little bit more about why you and your wife had decided to do the preconception screening?
Sure. There are thousands of rare diseases in the United States and the world. And many of those diseases have underlying genetic causes. Some of those are due to spontaneous mutations that arise during development. But many of those are due to mutations that have existed in our DNA for long periods of time and have been passed down from generation to generation. And as is the case with a disease like Tay-Sachs, what is called an autosomal recessive disease, both parents have to have a copy of that mutated gene in order to pass it along to the kids. Carrier screening is a technology that we have to be able to screen both parents for the presence of mutated genes for a number of different diseases. These include diseases like Tay-Sachs, cystic fibrosis, Gaucher disease, sickle cell, and many, many others. And as our knowledge of genetics and our technology has gotten better, particularly over the last 20 years, we can use an individual's DNA to look across the entire genome for genes that may have mutations that could potentially put kids at risk. And now, today, we can screen for hundreds of diseases that could be passed on from a parent to a child. It is profound technology and so powerful. There are certain populations that are traditionally at higher risk for some of these diseases. The Jewish population is one of those, and there are increased frequencies of those mutated genes in the Jewish population. And so there are some populations of people where there are guidelines that recommend testing for many different diseases. Some people may argue that we should test everyone for as many diseases as we can because we can have a really profound impact that way. But the guidelines at this point do call out the Jewish population as one high risk population in particular. Both my wife and I are Jewish by heritage, and we pursued preconception carrier screening. So carrier screening before even start thinking about starting a family to
Mhm.
understand what our risk was. Unfortunately, today, most carrier screening is done once people are already pregnant, which in some ways kind of defeats the purpose or at least dilutes the power of that technology and intervention.
Right, right. And we did talk to a genetic counselor, I believe, with JScreen, Natalie, about pre-implantation genetic testing and PGT. And so that's an area where this carrier screening could potentially have more power before conception. And there's the ability to even do testing before the embryo is implanted.
Absolutely. That I think is it's something that my family has benefited from. We have three living children. So our first when Javi was diagnosed, my wife was 11 weeks pregnant with our second daughter. And the day after Javi's diagnosis, we were in high risk OB. My wife was getting a chorionic villus sampling, which is a test like an amniocentesis to see whether the fetus was affected with Tay-Sachs. Kaya, our second, is a carrier. She has my mutation, but fortunately doesn't have two copies, just the one. So she's not affected with the disease. We used IVF and PGT for our next two children. We have two boys.
Hmm.
And our third, Ezra, he doesn't carry either mutation. So Tay-Sachs is gone from his lineage, which is just
Hmm.
incredibly profound.
Yeah.
And we're seeing that technology and that capability being used not only in the context of rare inherited diseases like Tay-Sachs, but also in the case of things like the BRCA mutation, which confers a risk for cancer, breast, ovarian, and other types of cancer. I was just speaking to a woman the other day who told me about her story as a BRCA carrier and using IVF with PGT to eliminate that gene, that mutated gene from her children, which
Hmm.
essentially takes that cancer risk, that increased cancer risk away.
Right. And as you said, it's very profound and powerful, right? That you can then take something that may have been running in the family for generations and now know that this person's tested negative and their children, grandchildren, great grandchildren, right? Now it's not a concern for them.
Absolutely.
I thought it was interesting too that you mentioned about certain populations have an increased risk for certain genetic conditions, and then, like you said, the guidelines sometimes are still sort of reflecting that, saying like folks with a Jewish background should have this type of testing, folks with African American background should have this type of testing. But really, the cost of testing has dropped significantly. So, those types of things were in place back when it was more of a stepwise type of testing, right? Where we'd have to test one thing, then another, then another. But now we have the capability of testing multiple things at once, and it's not nearly as expensive as it used to be, correct?
Correct. Yeah, we first sequenced the human genome in the year 2000, and it took the better part of a decade and cost $1 billion.
Mhm.
And we can sequence a human genome in a matter of days, and we can do it for hundreds of dollars. So the technology has progressed so much in the last 25 years. We have such capability now to leverage genetic information in really remarkable ways to understand and prevent disease. And at JScreen, we never want cost to be a barrier to this kind of testing, which is why we exist as a nonprofit, really, to
Mhm.
ensure that people can get access, even though the cost is quite low, relatively speaking. And in many cases, insurance does cover some different forms of testing, depending on your personal and family history. But organizations like JScreen also have philanthropic dollars to subsidize the cost if there is ever a barrier for financial reasons.
Yeah, and I think that's one of the important parts of the mission with JScreen is trying to make this test available because like you said, the cost is lower comparatively, but it's still not zero, and so there are still folks out there that would definitely benefit from testing that may not be able to afford an out-of-pocket cost. We've talked to a few folks like yourself who have kind of come from a science physician background and then found themselves almost on the other side of being a patient and have talked about kind of what does that mean. And I'm curious to know what that experience was like for you. I have found in working with a lot of the physicians and scientists I work with, they're information gatherers, right? And so they like the data, they like the info. How does that factor in to getting this devastating type of news that is emotional and it doesn't matter how much information you gather. There are some
Mm.
things that are unable to be changed. How did that impact you?
It's a great question, and it impacted me profoundly, I think, and it still does.
Mhm.
I think that part of physician training is learning that you have the power to save people's lives, that you have the power to make a profound difference in their care through medicine, surgery, treatment. And that is such a gift. And I think that we as a medical system we don't like to exist in the space where we have no options. You know, we don't that's not a comfortable place for us as a healthcare system and as physicians. And I think when we got Javi's diagnosis and realized that she was going to die, it really shook the foundation of my identity in many ways. You know, my training, my years of training, my research, all of that stuff becomes part of identity. I think being a physician is not just a job, it's like really part of who you are. And having a child with a diagnosis for which there was no treatment, for which there was no cure, there was no option, really shook that in a
Mhm.
very, very profound way. And I think in many ways the opportunity to do what I do now is a result of that. You know, it is a way for me to try and take this immense pain and turn it into something that can change the lives of other people.
Mhm.
I think it also really forced me to grapple with mortality and how we think about grief and loss
Mhm.
in our society, which I think, unfortunately, while it's something that we will all experience in our
Mhm.
lives, it's like the great unifier. We
Right.
really don't do a good job of teaching or supporting or helping individuals navigate grief and loss. And
Mhm.
my wife and I really had to feel our way along. I'm so grateful for her because I feel like she had a sense of how to do that in a way that saved our lives.
Mhm.
And she wrote an amazing book about it, which I'll just give a short plug for, called 57, which
Mhm.
really details our story and Hobbs' life. But it's been incredibly hard, and it
Mhm.
grief is also a very powerful motivating force. And
Mm.
I think Hobbs' all too brief life on this earth transformed me and transformed my wife and our life in immense ways, and ways that I am like so grateful for how this tiny little 2-year-old who never spoke a word had such an incredible impact on the world around her. Uh,
Mhm.
and I would give it all back to hold her for 30 seconds.
Yeah. Yeah. And I think, you bring up a good point about grief being something that, I mean, honestly, is the quintessential human experience. Everybody's going to experience it, but we don't always really know how to handle it or how to work through it. I've seen several talks that you and your wife have given about maybe navigating grief or kind of using it, I think, to inspire movement. I think in one of the talks I can't remember if it was you or your wife said, to not disintegrate, but to turn it
Mm.
into action. And so how did your faith influence some of this grief and being able to turn it into this movement?
Yeah, it's a great question. It's a beautiful question. I think faith and spirituality were two areas that maybe as a physician scientist, I didn't ever really give the proper due to. And it became clear after Hobbs' diagnosis and especially after her death that there are just bigger forces at work. And those things are important anchors. They are important scaffolds to help us navigate the things in life that we can't explain or understand. And they also help us to answer questions that we don't know how to answer and to find the community and support structure that is so helpful in getting through every day. And one of the things that we did in particular, which became a beautiful tradition and ritual that we celebrate now, is something called Shabirthdays, which is sort of a silly name combining Shabbat and birthdays, and really evolved around and out of my wife's recognition that we were only going to have two birthdays with Hav on this earth, and that was not enough. And we decided that we would celebrate her every Friday, and we would combine essentially a birthday with Shabbat. And
Mhm.
it became a holy time. It became a celebratory time. It became a painful time, but it brought us to a way of living with presence and pain that
Mhm.
was sustaining. And as Suki Miller says, ritual is the antidote to helplessness. And I think finding those types of rituals was a way to continue forward and is
Mhm.
still for us today.
And I think, like you said, to bring that the presence to the pain, so not to avoid something because of the potential of pain, but to incorporate it into this new ritual to help you have that momentum and kind of, like you said, moving forward.
Yeah.
You talk some about the JScreen mission, about making this testing available, broadly to other folks. And I still remember ordering testing from JScreen 20-ish years ago when it was maybe the Victor Center, I think. So, it's been around for quite some time. And again, it's just been incredible to see it grow the way that it has. I think recently you all were on the Today Show where you were giving or working to give out tests. So was it 300 some people, I
Yeah.
believe?
Yeah.
Yeah,
Nearly
so hundreds.
300. Yeah. Nearly 300 people that morning.
Yeah. So tell us more about JScreen. What is the mission? What is the goal? What are you and your team trying to accomplish?
Yeah, so JScreen, as you said, has been around for a while. We are a national telegenetics navigation program that is focused on providing education, access, and really high touch support to and through the genetic testing journey for individuals, families, and also as a resource for clinicians and healthcare providers. There is a tremendous lack of knowledge out there. Genetics is complicated, and it's difficult to figure out what you need and when you need it, and obviously how to understand and know what to do with the results of those types of tests. And JScreen has evolved to become an organization that tries to fill and solve all of those issues for individuals and families, from trying to understand what tests do I need and when, to how do I navigate insurance, to
Mhm.
making sure that you understand the results and know what to do with them and who you may need to go see and what types of things you may be able to do. And we really pride ourselves in an always on, super high touch, high support model to make sure that people feel really taken care of. And look, had I known about JScreen, had my physician known about JScreen, Javi would still be here. And I
Mhm.
think that is the biggest example of how important the service that we provide is. And as I said earlier, we're a nonprofit. I think we
Mhm.
really see patients as our only shareholders, and we are so committed to that cause and mission. The nonprofit allows us to do things and to support people in ways that other similar organizations in the for profit space may not be able to.
Definitely. I think it allows, like you said, with some of the philanthropic giving to be able to help folks who may be underinsured or yeah, not have the coverage that's needed. And JScreen offers the carrier screening that we discussed, but also hereditary cancer, correct?
Correct. Yeah. These are two areas: inherited rare disease, as identified or screened for through reproductive carrier screening, and then hereditary cancers, of which there are many, not just breast cancer, which is probably the most common or well recognized in the BRCA gene, the BRCA gene. These are two areas where preventive genetics is really robust and profound technology. But there are other disease areas that,
Mhm.
as our knowledge gets better and better, we can take similar approaches for. So, hereditary cardiovascular disease is another area. We don't offer that right now at JScreen, but it's something that is on our roadmap, and hopefully will be an additional tool that will be available for people in the future.
Yeah, that would be wonderful. I know we've talked to quite a few folks who have had cardiomyopathies and other types of cardiovascular genetic conditions. So you mentioned, trying to make things more affordable. What types of support do you give the patients, or like you said, even the physicians in terms of Do they get to talk to other medical providers? Is there some sort of clinical support there?
Yeah, so JScreen staffs a number of genetic counselors. So anytime someone signs up for a test with JScreen, our genetic counselors review their registration information to make sure that they're getting the right test, and that if there are any additional issues or questions that need to be answered, that we're able to gather that. And then we help individuals navigate the insurance system in the case that they choose to use insurance, or if they choose not to use insurance and elect to pay cash, to make sure that that cost is not a barrier for them, and that if they need to receive financial aid, that we're able to support them through that as well. And then on the back end, once their results come in, again, our genetic counseling team reviews all of those, and we have genetic counselors who are available to help answer any questions and to really guide individuals to what those next steps may be. And in many cases, help make connections to the right hospitals, clinics, or physicians should they need additional care. And we follow up with every patient 2 weeks and 6 months after their results come in, and obviously more for individuals that are high risk or who need additional support.
That's wonderful. I was not aware of the follow-up, so I think that's great because that's one of the areas where sometimes it can be a challenge, with some of the labs doing that longer term follow-up. If you were, like, out and about, 'cause I have a lot of my genetic conversations when I'm running it to activities, let's say, around the neighborhood, or at school, and somebody talks to you about genetic screening, but they're not sure if they're gonna do it. They're somewhat hesitant. What is it that you would tell them to consider or to at least think about when making that decision?
Yeah, I think that the fear of genetics is real. The fear of finding something out that portends the possibility of disease in the future is a very real concern. I think what I say to people a lot is that this is the most profound, powerful medical technology that we have. It truly can save your life. And the beautiful thing about an organization like JScreen is that should you find out that you are high risk, should your results come back that you are high risk for a certain disease, or that you and a partner are at high risk for passing that along, you're not out there alone. We are there to support you and to help guide you through the next steps in the process, and to connect you to the right types of support services, of which there are many, many whom we partner with
Mm,
directly, as well as to the right hospitals, clinics, and physicians. And I think having lost a child to a disease that could have been identified and prevented, there is such power in having that knowledge. That is not something that we should run away from. That is something that we should embrace. We should embrace it for ourselves, and we should embrace it for our families.
well, and I just appreciate all the work that you are doing to make it available to other families to
Thank
to
you.
let them be able to have that choice. So I think the only thing now, which I'll put in the show notes too, but where do we go to find out more about JScreen?
Yeah, of course. Super important. If you are interested in learning more or getting a genetic screening test, go to jscreen.org, www.jscreen.org, and we've got tons of information, places you can reach out with questions, and one of our amazing team members will help you along the way.
Perfect. Well, thank you so much, Matt, for being here. Like I said, sharing your story, your experience, and then also sharing the mission of JScreen.
Thank you so much. It's great to be here, and I hope that it's helpful.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all the episodes of the show. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Please rate and review the podcast on Apple, Spotify, YouTube, or wherever you listen. This helps other people like you discover the show. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. All Access DNA is an independent podcast hosted and produced by me, Kate Wilson. Designs by NKJ created the logo. Thanks for listening, and join us next time.